If you need a surgical termination and your local hospital happens to be Catholic, doctors there may refuse to perform one, even if the hospital is receiving funding from the government. And not just that, health professionals at Catholic hospitals can't insert an implanon or an IUD or prescribe the pill unless it's for something other than contraception. One senior gynaecologist told me that the Mercy Hospital for Women, a Melbourne hospital specialising in women's health, doesn't even comprehensively treat sexual assault victims because they can't prescribe emergency contraception. A spokesperson for Mercy Hospital, in a statement provided to The Guardian, said, "Clinicians use clinical judgment with reference to the Catholic Code of Ethics and establish partnership arrangements with other public health services to ensure patients receive the comprehensive care they need." There are 15 hospitals like this around Australia, of which at least 5 offer specialist maternity or gynaecology care. People who give birth in Australia are usually assigned a hospital based off their postal address. Here are some ways that your care may be different if you go to a Catholic hospital. You can't get your tubes tied at caesarean section even if you ask for it, which means if you want this procedure done, you'll need to organise a second surgery under a second anaesthesia at a later date at a different hospital. Secondly, you won't be able to get contraception. So if you've just had a baby and you would like birth control, this is something that you'll have to organise at a later date with a newborn in tow. And most concerningly, you may have had excellent maternity care through the course of a pregnancy and then find out that you have a condition that threatens your health or that the fetus likely won't make it to a viable birth. In which case, the doctors may tell you, unfortunately, if you choose to terminate, they'll no longer be able to continue your care. A recent Senate inquiry recommended that public hospitals be equipped to provide surgical abortions.
Publicly funded hospitals subject to a Catholic code of conduct have been refusing to provide abortion care, even by doctors who don't themselves have a conscientious objection.
But it stopped short of actually requiring these hospitals to provide the service. Dale Kelleher of Children by Choice says that governments should require public hospitals to provide abortions as a condition of their funding, something Prime Minister Anthony Albanese indicated in July was unlikely to happen. But Kelleher says public funding should be tied to the delivery of a full suite of pregnancy outcomes. She says, all pregnancies have an outcome, whether that be miscarriage, stillbirth, birth or termination. All of those outcomes should be covered with public money.